Honorable delegations of the Member States, dear Mr. Chairman, Your Excellencies, dear colleagues in the room and also in the cyberspace of the webcast. With due respect to my fellow candidates, this is my turn now to introduce the program of my candidacy. It is a great honor to be nominated to the Director General position of the WHO, but it is hopefully an opportunity as well. An opportunity to shape WHO's agenda, the global health agenda, during the candidacy and even beyond. I'm sure that we have to shape this agenda, or put it more bluntly, we have to offer new approaches and new perspectives. Otherwise, the organization that we cherish might lose its influential role in shaping health agenda, and the stakes are high. If we decide to carry on with the same paradigms that yielded many results but were established decades ago, we might risk to become a non-influential factor in an over-challenged age. That's my understanding about the challenges. I believe that the world's one and only impartial global health organization is more important than that. So my message to you is simple. WHO needs change. I'm an agent for change. And if you opt for change, please consider my program. You convene here to prepare your decision for selecting the next Director General of the WHO. And who are you looking for? I'm sure that you are looking for somebody who could successfully lead the organization, and you are also looking for somebody who could work better health globally at the same time. And you know, it is a matter that is not easy, neither to you as decision makers, neither for us as candidates. WHO is challenged by many external and internal issues that have already started to erode the name of the world's only impartial global health organization. Can we stand the race in the institutional environment to keep up our position, or are we losing ground to dynamic new ones? Is WHO resilient enough to endure pandemic outbreaks? Can WHO fulfill its mission facing budgetary constraints? Do internal structures and procedures empower WHO to step up action for health, or does internal politics or division paralyze or bureaucracy strangle action? You know, when I was reading the web forum questions, there were 170 questions the member states sent in. These were the exact same challenges you were raising or you were asking for, and that made me think a lot. And you know, however preoccupied with we are with the organizational challenges, we should not forget the reason why WHO is on Earth generally. And this is better health globally. Health is also challenged in many different ways in each and every very complex region of WHO. Climate change, water crisis, poverty, regional conflicts, unhealthy lifestyle, all these represent a challenge through novel and emerging diseases, and opening way to a drastic increase of non-communicable disease, mortality and morbidity globally. You know, with the 170 questions that arrived during the web forum, member states themselves urge action to tackle these problems that challenge not only the sustainability of our health systems, but also the sustainability of humanity itself. You know, but before moving ahead, there is an obvious question which needs an answer and that I do not want to evade. How can a former Minister of State, an academic from a small country of 10 million from middle of Europe, a newcomer to WHO, can answer all these challenges? And you know, that's the answer I do not want to evade, the question I do not want to evade. And my answer to this question is this. Let my country be small, but the public health problems that we had to face and the global forces behind those challenges were as big as anywhere. I would say that it is not the size of the locality that matters, but the size of the problem. You know, my conviction is that the solutions that WHO needs are of the same nature that we carried out in Hungary. We in Hungary met the same pressures, starting with the challenges and finishing with the customary risk aversion of politics from deep and interest-harming changes. We took up these challenges and gave a sustainable solution to them. What you need is a capable leader with a pragmatic and feasible program. And I believe you need someone who is able to manage change in a sustainable way. You need somebody who will translate public health knowledge into courageous action while maintaining the dialogue with a complex set of stakeholders. Someone who can reinstate the image of WHO and bringing fresh new spirit to the organization and has proven commitment to the core values and mission of the organization. You need someone who will work for better health and stronger WHO. And that is my program. In the following 25 minutes, I will talk about actions I will take, the change that I will foster, and what the new spirit and experiences that I bring to the organization mean. My program, Better Health and Stronger WHO, concentrates on 4 action areas and the organizational change efforts to tackle the challenges for health and WHO as an institution. For better health, which is the #1 priority, we have to take action along 4 priorities. Struggle with disease on the fronts of communicable and non-communicable disease. Move towards sharing the risk for universal health coverage and pandemics. Facilitate development of human resources for health and balance workforce migration globally. And promote innovation and technology to improve accessibility and equity. Let's start #1. The struggle with communicable disease has one top priority: fighting pandemics with speed and agility and culturally tailored interventions. The learning from Ebola outlined 2 concerns for global health security. Can the modern interconnected world live without some forms of global health governance? The other is, can WHO stand the test of pandemic outbreaks without becoming an operational organization? And my answer is no in both respects. We have to promote these ideas through increasing local responsibility, supporting and supplementing missing or weak or local skills and capacities through development, training, global mobilization of resources, and an outreach of coordination. WHO should transform and emulate some functions of global health governance and an operational organization through proactive involvement. The promotion of international health regulations and the institutionalization of the emergency medical team network represent 2 solutions which I strongly support, and that means a global mobilization of resources. WHO's performance in pandemic preparedness is key for future research generation as well. Special attention should be given to countries that are emerging from conflicts. These countries many times surviving conflicts without public administration systems. And the reconstruction of public health structures should be an integral part of the reconstruction, respecting national leadership and building on local resources. The Hungarian experience fighting back communicable disease represents that we can win this fight with consistent effort. And let me allow a personal example. 2 generations ago, 2 of my grandparents and 1 of my aunts died in tuberculosis. It was a fearful morbus hungaricus at that time. And my parents, both of my parents, became pediatric pulmonologists. And they were the generation of doctors that fought back TB with the assistance of Green Cross TB nurses. And today, Hungary is one of the leaders in immunization and surveillance. When we introduced HPV vaccination in 2013, in the first year already, 80% of mothers requested their children to be vaccinated. So this is a consistent way to win over and receiving social support to these public health efforts. Unfortunately, we are not that good on the non-communicable disease front. A generation later, as Minister of State for Health, I had to face the new morbus hungaricus, lung cancer, and also cardiovascular disease. And you know, we are unfortunately the leaders, world leaders in those two as well. You know, feeling the pressures, I had to take urgent action against smoking and unhealthy diet. The odds were against me. We were in the deepest point of world economic crisis and European austerity, where short-term economic gains and risk avoidance could prevent any economic risk-taking. We did not let this happen, and in 76 days, we pushed through, a strict non-smoking regulation, and in the course of 3 months, we introduced the public health product tax and later ruled out trans fat from food. All this in a 1.5-year period. We were able to raise long-term health benefits above short-term economic and political gains. With this experience, we arrived at the global fight against non-communicable disease. This fight is much more complex through leadership, social mobilization, and awareness for behavioral change. We know epidemiological evidences. I think WHO is the best place for that. We know what should be done. To turn knowledge to action, we need clever behavior insights and achieve mastery and behavior change to be able to outsmart antagonizing industry opponents and their marketing. To win this fight, WHO should transform and grow not only to be the indisputable leader in global health, but also a leading international change agent for health. That's the way I see it. That's the way I see WHO in the future. And we should break out from the inbreeding of our internal professional wish lists. The health community should be able to influence the agendas of political and fiscal leaders. We agree on many health affairs, but we have to change the focus of persuasion. And we have to make them act towards solutions. WHO should take a role of independent knowledge center as well, and translate knowledge to action in assistance, close assistance to member states in their health developments and reforms. Leadership. I think this is the most important asset in the fight against non-communicable disease. From the voluntary contributions, which is around 80% of WHO's budget, we spend less than 2% on the biggest killers. If we do not have enough resources for a comprehensive NCD fight, then we have to do it one by one, year by year, each and every disease modality. If there is no budget for it, then we will have to travel and advocate. We cannot ward this war from our Geneva offices only. We have to be there with the trenches with the member states, in the trenches with the member states. Meet the key decision makers. Persuade them, reach out to the public by building behavior insights, be the bodyguard of good initiatives. We have to convince people to give up smoking. People have to eat less and more healthy and be more active physically. Producers have to put less salt and sugar to the food and do business from more healthy products. In 2015, about a year ago, the health community received very good news. Heads of state accepted the Sustainable Development Goals. And this represents a new voice and a new chance to save the planet and humanity. And SDGs, at last, addressing a comprehensive set of health determinants that we were waiting for so long. But I have a pragmatic message to you. SDGs and its health priorities will stay a dream without the relevant global investments. And this leads us to the next action area in my program. We will have to take action for generating resources for sharing risks in universal health coverage and pandemics. Despite the unprecedented efforts of global donors, we have to understand that neither the implementation of NDGs nor sharing the risks could be managed without sustainable and institutionalized funding. It is time to start a long-term effort for institutional resource generation. Innovative economic models for generating resources could only happen in dialogue with a comprehensive set of stakeholders. Let them be government, international agency, civil and non-governmental actors from various financial and business communities and business organizations. Investment in global health should promote efficiency, prioritizing prevention, promotion, primary care, integrated patient pathways, fostering innovation and technology. We in Hungary use the public health product tax as an innovative resource generation tool. Basically, we not only tax added salt and sugar in food, but we manage to influence producer and consumer behavior at the same time. That's why we call it an innovative resource generator, because it influences behavior as well. 40% of producers change their formula and put less sugar and salt in chips. People consume 25–33% less from goods indicated by public health product tax. With this, I do not want to suggest that WHO should introduce a global public health product tax, however tempting that idea would be. That would be impossible. But what I want to demonstrate, that with the Hungarian success story, that we could take leadership in the search and advocacy for innovative resource generating models. And you know, we should, at WHO, we should not stop at analysis. We should not stop at researching evidence. We should change the way we work, and we should mobilize creativity of the global health policy network, the health policy community, to be ready to generate 21st century governance, resource generation, business models, and procurement. This is true for pandemics, true for universal health coverage, and also true for issues like antimicrobial resistance, new antibiotics, vaccines, and access to high-priced medicines and technology. Finishing the second area, the resource generation, I'm turning to the third area where we have to act, and this is human resources for health. Better global health can only be achieved through the organized action of well-trained human labor force. Let them be community nurses or primary or vaccination doctors in low and middle-income countries, or surgeons in high-tech micro-invasive surgery facilities, or home care nurses in chronic care services. We in Hungary have 72 years life expectancy for men and 79 for women. This, though, is a result of paradoxes. We have districts where middle and upper class people live as long as Scandinavians or Japanese, and have disadvantaged communities who live with the risks of low and middle income countries. And I have the family and life experience that building universal health coverage starts with strong foundations in community and primary care professionals. Originating from the community we have to address. Training and development of them should be a top priority. In Hungary, sorry again for the example, this is again just to present an example how we could do this. In Hungary, the resources generated by public health product tax were used to raise the salaries of 100,000 nurses and doctors to slow down workforce migration. This again is not a suggestion to copy globally what we did. This is demonstrating that generating resources for health is not a selfish act. With this, we generate jobs, taxes, revenues, health and economic development. WHO should take the leadership in fostering investment in health as creating economic value as well. Human resources crisis forced us to look for solutions to supplement missing resources. And that is turning our attention towards the fourth action area, which is technology. Having successfully created a 21st century national e-health regulation and being part of the European e-health task force and joint action, I strongly believe that e-health and m-health can play a role in 21st century like vaccination played in the 20th. We might take health with point-of-care devices, wearable devices, to places where they never existed before, and also mobilize technologies to reach people in the flow of migration. With a social media giant shooting up drones to cover the world with Wi-Fi, free Wi-Fi, there is a new challenge whether these technologies will be accessible to relaying health or plainly marketing messages. We have to act and foster the development of an ecosystem for these new types of care that has the potential to fundamentally improve the access to prevention, diagnosis and care in a very cost-efficient way. In the previous part, I covered the 4 most important action areas and the changed approaches that a stronger WHO should follow. Let me summarize the 4 core organizational characteristics where WHO should grow, transform and develop. These are resilient action and performance orientation, change management capacities, risk communication, and working in partnership. Let me start with the first one. WHO should be resilient, action and performance oriented. Promoting the idea of resilient health system towards member states should go hand in hand with the working for a resilient WHO. The global portfolio of projects should be managed in a structured framework focusing on teamwork, results, problem solving, and be enhanced by personal commitment and accountability for member states. The global policy group is a good development. It has to be complemented with a performance-oriented referral system to feedback achievements, results, and also for rapid troubleshooting. This performance management is to be done as an outreach to regions and member states to work in alignment in the whole WHO. We should improve change management capacities for behaviorally, culturally tailored local interventions. No technical or external solution is valid without local ownership. I have learned it from experience. Evidence-based health policy should go together with change methodology. This is important to note that talking about change, I do not mean a full frontal attack on everything. I know and I have learned from experience that it should contain including people involved in change, dialogue, consultation to prevent resistance, and build and develop the momentum to intervene. These are core to sustainable change. The third organizational characteristic. We should rebuild trust and prevent unmerited blame by strengthening the risk communication capabilities and managing expectations proactively. Performance and trust is vital to stabilize funding of WHO and its priority programs. Number 4 is about partnerships. WHO should work in renewed global partnership based on consultation and dialogue and assertive collaboration. Health problems are far more urgent and challenging than what a single organization could ever bear. I will work to achieve effective collaboration partnerships and coordinated actions with UN and with member states, donors, international stakeholders, civil society, and non-governmental actors as well. WHO should renew partnerships acting as an umbrella organization in this changing institutional environment with loyalty, transparency, and accountability to its partners. I arrive to the conclusion. In the coming period, complex challenges will test the credibility and resilience of the world's only impartial health organization. My understanding is that the world's health security is at stake. WHO resources are also dependent on its performance. Better health, stronger WHO. In my presentation, I outlined how do I see the current challenges for health and challenges for WHO as an organization. I gave a summary of actions I will promote, changes that I will foster, and the way I will approach the work of the Director General. I plan to do the job with independent and courageous spirit, to raise the interest of health above short-term economic gains and political risk aversion. I have a proven record in working in team with public health experts and making their wish list a reality. That is what I'm offering to you, to make public health dreams come true under strong double-age leadership. Thank you very much for your attention, and I'm ready for your questions.